In this video, we're going to talk about AP mobilization on mastoid process. This typically goes with the cranial suture series as you're working throughout the cranium to decrease any headache symptoms, neural tension-y type symptoms. Mastoid process is also really important to treat when you have someone with jaw pain. So people that have TMD, it would be a great place to clear. But also people that have upper cervical spine dysfunction. And specifically, people that have upper cervical spine dysfunction, there tends to be well, I shouldn't say that. It would be worth checking if a mastoid process has an hard infill anterior to posterior on one side versus the other, okay? So if we have a C1, and there's a C1 shear video, so make sure and check that out. If we have a C1 that is sheared off to the right side, okay, doesn't want to go to the left, could the mastoid process be contributing to keeping that C1 sheared to the right? If so, I would guess, or I would hypothesize that the opposite side mastoid process is stuck forward, not allowing that C1 to go back towards that left side. Okay? If it's sheared, if you're stuck C1 sheared to the left, I would hypothesize that the right mastoid process might be stuck in an AP anterior position, not in the way of allowing that C1 to shear back towards the right. And again, with the orientation of C1 versus mastoid process, any amount of movement is going to kind of restrict motion in the opposite way. So even if the mastoid process isn't in perfect alignment with that C1 to block, then the myofascial structures could be contributing to not allowing that C1 to come back. So I just want to mention that. So to mobilize mastoid process, I'm getting onto the front of each side of the mastoid process, and I want to feel positionally, does it feel like one side is sitting more anterior than the other? And on Kelsey, it feels like the right side is sitting more anterior than the left, okay? Then to confirm that, I would say, okay, let me spring test that left side. That feels springy. Spring test the right side. That feels harder. Okay, so I'm interested in mobilizing the right side mastoid process anterior to posterior. If the same thing I felt positionally, the right side was forward, the left side was relatively back, and I spring test the right side anteriorly, and that felt springy, whereas I spring test the left side posterior and that felt springy, then I would think, oh, maybe I should go to the posterior aspect of the mastoid process and check a posterior to anterior spring and see if maybe that left side is more hypomobile posterior to anterior, okay? So most of the time, an anterior to posterior is a dysfunction that you're gonna find, but just know that sometimes a posterior to anterior might be more dysfunctional with the spring test. In this case, right side anterior to posterior is more dysfunctional. So I get onto that hard infill, sink in with the pad of my thumb. Try not to sink in with the pokey part of your thumb. So I sink in with the pad. I bring her head to a more neutral position, okay? And then from here, I check if I side bend her to the right versus side bending her to the left. When I sink into that infill, bring her to neutral, side bend her to the right, that kind of softens things under my thumb. When I side bend her to the left, it wants to poke up into my finger. So I'm like, okay, this is where I want to be, okay? Now my options here is I could have her nod, and this is a lot of times what I do is a nod and let it go. For people that have a really dysfunctional mastoid process, it can be very tender and nod down. So oftentimes I'll have them just nod, which is an assisted, basically if they're nodding, that mastoid process should go down towards the table, so it's an assisted motion. If they can handle it and it's not too painful, or they're just like, do what you need to do to make me better, then I can block the mastoid process anterior to posterior and then have them lift their chin up a little bit, and that typically is more tender and let it go, but it's a little more aggressive and can engage that infield a little bit better, okay? So that's the anterior to posterior mobilization with a little side story that it could be a PA to the mastoid process. And again, it could help headaches, TMJ or TMD, upper cervical dysfunction, all of these type things. You want to at least check the mastoid process.